Hello, today I'm interviewing Kelly McCalla. She is a licensed marriage and family therapist who practices in Issaquah, Washington. Kelly is specialized in trauma therapy and eye movement desensitization and reprocessing EMDR. She is also Washington State supervisor, meaning she is approved to provide clinical supervision to therapists working towards licensure in Washington State. Hi, Kaylin. Thank you so much for meeting with me today.
Hi,
I really
Martha.
appreciate your time and your willingness to share your work and experience in trauma.
Yes, thank you. Thank you for the
So,
introduction.
thank you. So I will, if you don't mind, I will just start asking you. I know you are busy,
Mhm.
so I will go. I want to begin, and I would
Okay.
love to ask you, how do you understand um, a trauma and the trauma healing in your clinical work?
Yeah. Um, so yeah, thank you for sending the questions beforehand because I had a chance to review them and to think about them. And I mean, trauma, I think is such a big word. And what I've noticed, so I'm going to give you the answer like I give to clients, but for me, trauma is really anything that changes the way a person views themselves. So I feel like we're born not necessarily believing negative things about ourselves, but it's our experiences that can, yeah, change the way we view ourselves and change the way that we feel in our bodies and the way we show up in the world and in relation. Um, so I feel like it's through that lens where we kind of work towards trauma healing is trying to identify the moments and experiences in a person's life that altered their self-worth, that altered the way that they view themselves. Um, yeah, I think that answers that question.
Thank you. That helped frame trauma healing as more than symptoms reduction. I would love to move to the next question. How do you create safety in the therapy room?
Um, yeah, so I think an important way to create safety is to be authentic. So I am who I am, and by being authentic, I feel like it helps create that safety for clients so that they can feel that they can also be authentic. Um, Also, in particular, if we're doing like an EMDR reprocessing therapy session, I might ask people like, hey, you can bring in comfort items, or I allow people to sit wherever they want in the room, however they want, allowing themselves to be comfortable. Um, some people want to be able to see the door, not have the windows behind them. So just being flexible with people on what they feel comfortable with. Um, Sometimes it is like mirroring or expressing like a certain tone. So if someone's really soft spoken, maybe kind of matching that. Or if someone's really angry, like letting them like have space for that. Um, so yeah, also just having a space and acceptance for a range of emotions that can come up for people when we're doing trauma work. Um, and being non-judgmental with them about that.
Trauma work can feel very vulnerable for clients, especially when they are sharing painful memories or experiencing connected to fear, shame, betrayal,
Yeah.
like loss of control.
Yeah.
My question for that is, how do you approach trauma treatment in a way that feels safe, relational, and trauma informed?
Um, yeah. I guess to piggyback on something you reflected earlier, where it's not just about like symptom reduction, I think that's what makes it relational is kind of starting to think about the person as a whole. Like, who is this person in this room with me? What contextual information is important to consider? What is their story? Um, Something in particular about EMDR work we say is like the past is present. So being really curious, like maybe about their symptoms and how they're showing up, but how they're showing up relationally for people. Um, so like if a symptom maybe is like low self-worth or anxiety, like, okay, tell me how that shows up at work. Like what situations maybe are potentially like triggering for you or bring up these negative self-talk. And sorry, pause. They're washing my windows right now, so I hope it's not too loud.
No, no, it's perfect. Thank you so much. I really appreciate your time. Thank you.
Yeah, like of course. And then can you repeat that question? I just want to make sure I got it all.
See, yeah, but how do you approach trauma treatment in a way that feels safe, relational, and trauma informed for your patients?
Okay, I'm going to try to pause the audio when you're talking because the window cleaners. Yeah, trauma informed, I think in a way to do that is to consider the symptoms as, yeah, as relational rather than like symptoms in the DSM. But yeah, like looking at the whole picture and thinking about a person's context and how they're showing up in the room.
So, following up,
Mhm.
how do you know when a client is ready for deeper trauma processing, such as EMDR?
Yeah, that's a great question. Um, I think different providers are going to have different answers to this. But one thing I'm looking for is,
I cannot hear it.
you can't?
No, I hear you, but I cannot hear them.
Okay. Um, that's amazing that you can't hear that.
So,
Uh,
like, how do you explain, like, how do you notice, no, that your client is ready for trauma processing with EMDR?
yeah. One thing that I'm looking for, there's a couple things I'm looking for is how resourced they are. So, and I don't just mean like, um, but yeah, how resourced a person is, like what internal strengths and things that they might have. Do they have support outside the therapy room, like community or family? That could be, you know, religion or a group that they're a part of. Um, Also, like I guess without getting too into like ego state therapy, but just doing like an assessment of a person's different parts and if the whole system is willing and ready to do trauma work, like the deeper trauma work. Sometimes in EMDR in particular, like before we actually start EMDR reprocessing, we might be doing like ego state or like IFS type work, so that person can feel like a certain sense of like safety and stability before we do that. But also the nature of trauma work is, and I think this might answer one of your later questions, but I think one of the natures of trauma work is trusting the process and knowing that we are going to be drudging up um, deeply painful things for people, and they might have a period of time where they get more reactive or things feel worse. Um, but I think as long as you're really grounded in a therapeutic orientation that you feel confident in, and trusting the process that you're going to help this person get to the other side. Um, so sometimes, right, like you might start reprocessing and different things will come up for a person, but as long as you've identified different grounding skills that you can use beforehand, different like internal resources, external resources, um, collaboration with other maybe providers that that person might be working with. Yeah, I think all those things kind of can help a person get ready. So yeah, just kind of proper clinical assessment beforehand, making sure that they're resourced and have coping skills, um, and yeah, trusting the overall process.
I really appreciate that. It sounds like safety is something we actively build through pacing, trust,
Mhm.
consent, and regulation.
Yeah, yeah. Consent, that's a good one. Like usually people, I'm not sure if you're interviewing other like trauma therapists, but I make it very clear that I am an EMDR therapist, and I would say being in private practice, majority of the clients who come to see me, like that's what they're coming for. So there is already that consent or that buy-in into that modality, um, which, considerations for that would be different maybe if you were working in community mental health or more like an organization. So also just being, I think, mindful of where you're working and the population and providing psychoeducation on the modality is helpful too.
Thank you. Trauma work can be meaningful, but it can also be emotionally draining for clinicians. What challenges have you encountered in trauma work, and what has helped you navigate them?
Yeah. I think, I mean, hearing people's painful stories can be challenging. I think if you work, what's been personally most challenging for me is maybe working with people who I feel share like a similar story. As you know, that can bring up like your own feelings and like reflection on your life and making sure, right, that you're not bringing that into the room. Um, Something more recent that's happened as like I've grown and um had my own children is now like doing trauma work that involve like someone's child or like significant abuse to a child is, I mean, it's always been sad to hear, but it has added a different layer to it. But also that layer has added like a strength and empathy to be able to, yeah, just be present for my clients. So I think that is well, yeah, one of the challenges, right, is you are hearing people's most painful and sad moments, and you're holding that space for them. And oftentimes, with the nature of our business, it's like back to back to back. And sometimes at the end of the day, you're like, well, that was a lot today. Yeah. Um, but again, I guess I think something that I fall back on is I really found like an orientation and a model that I feel really grounded in, and I trust the process. So even as people are going through something really painful and really hard, I know that they're also healing at the same time, and they're healing through the work, but they're also healing like through relation with me. Um, and this probably answers one of your later questions too, but doing your own therapy, doing supervision, attending a consultation group, um, having friends who are therapists, like having your own community around you, I feel like really helps.
Yeah, I like that you went to that route because it's my next question was like how you care for yourself while
Yeah.
doing trauma therapy and
Yeah.
like the supervision and consultation and the support practice. It's you need to have something to that help you sustain all that. And so thank you very much for sharing this. It's such important reminder for counselors and training that we need to be present not just for the client but also for ourselves.
Yeah. And I think I guess to add to that, right, is um well again, this is impacted based on where you work, but having a good work-life balance, really learning. If I think about, um, I feel like I was much more greater impacted when I was fresh out of graduate school, by my clients and having less of like a work-life balance and having more difficulty like separating myself. Um, I remember my graduate, one of my professors said, "Don't let your clients go to bed with you," meaning like
Yeah.
don't like fall asleep like thinking about them. Um, and I feel like we're drawn into this field because we care about people and we want to help people and we want to um yeah, I mean and we want to help people and sometimes that process, especially with trauma, can take a long time. Um, because you might be just working on building rapport and safety with a person and teaching them coping skills and emotional regulation skills. Um, and I I feel like me personally as a therapist at first, I was like, I want them to feel better now. And I want them to heal now. And I want to do something like really significant in this one session. And I think with experience and time, I've learned, that doesn't happen. And it is that time that is also healing. And yeah, like I said earlier, trusting the process too.
Yeah. And with that, like trauma doesn't happen in a vacuum. Many
Mhm.
clients have history on connected with family systems, cultures, oppression, racism, gender-based violence, poverty, and discrimination and other systemic harms. So how
Yeah.
do you attend to your own identities, bias, personality, and in the counseling relationship? How do you manage that in front of your client?
Yeah. Well, I my graduate program was a systems oriented program, so I feel like that helped lay the foundation for understanding like systems and learning to understand how those factors will influence and shape a person, not only for the people across from you, but also within yourself, right? So I think it can be helpful to start exploring that within yourself too. Um, I also think it's a fine balance of having cultural competency and understanding and also being genuinely curious and open, not expecting the client to educate you, but also not assuming that because someone looks a certain way or has a certain background that they feel certain things either. Um, Something that I feel like I've observed um, happening is we have a client who is similar to us in some ways. And people can make assumptions like, oh, because we are similar, they must feel the same way. Um, so whether a person looks different or similar than you, I think just being curious and open and letting them tell you their story. Um, but that doesn't, I guess it really does come down to doing your own work and being open to exploring those biases within yourself and acknowledging what they are and being open to working through them. Because those implicit biases especially can, they're unconscious. So it can take work to uncover those and to be open to uncovering those.
Thank you. Thank you for
Yeah.
mentioning that. And as someone preparing to enter the counseling profession, I would love to end with your guidance for me and for other students that are going to watch this.
Oh man.
What advice would you offer to counselors in training who want to do trauma work in ethical, grounded, and sustainable ways?
That's a great question. I do think I touched on some of them. But again, so trauma to me is it is a like an umbrella term. And I think it's, being open to exploring like what kind of trauma work you want to do and what trauma work you feel comfortable with. Because you could have like early childhood attachment trauma, you could have sexual abuse trauma, you could work with, um, yeah, systemic trauma or racial trauma. So I just think having a clear understanding of like what fills your cup and what you feel good about working with. Um, and also, and I referenced this earlier, but I think when you are exiting graduate school, you're really trying to figure out who you are as a therapist and what theoretical orientation kind of jives with you. And I think just being open to exploring what that is and finding what resonates. And that can take some time. So to have patience with yourself, I think, gosh, so I graduated 2014 and I think I discovered EMDR in 2017. And I felt like once I found the theory, the modality that resonated with me, it helped ground me and it helped me find like my authentic voice. Um, because I think sometimes I'm not sure how this university is set up, but you know, you're introduced to different theories and you're learning them and you're testing them out. And um, sometimes you might try to be like the therapist you're watching, or but just kind of reminding yourself like it's a journey, it's a process. You're gonna find your own unique voice, and like that's what clients want. It's like
Thank
they're
you.
gonna work with Martha because they like what Martha has to offer as a person and from a theoretical orientation.
Thank you. One
Yeah.
last question. If
Yeah.
you could give one sentence of encouragement for future trauma counselors, what
Uh,
would you be? It's like, what would you say?
um, I think this is a bit of my theme, but I guess I would say like trust yourself and trust the process.
Okay.
Yeah.
Kaylin, thank you so much for your time and for sharing your wisdom
Yeah.
with me today. I really appreciate the way you spoke about trauma works. Yeah, you work with such a care, respect, and clinical depth. So I think that I'm taking a lot from you, and I really appreciate your time. I know you need to head to your next client,
Mhm.
and so I really appreciate. Thank you so much.
Yeah. Thank you.
Thank